The coronavirus has reached one of the most secure structures in the world, the White House. People working with U.S. President Donald Trump have been instructed to wear face masks that after 2 aides tested positive for COVID-19. Now, the virus has so far killed more than 80,000 people in the U.S. The new infections at the White House come as the president pressures state governors to relax pandemic restrictions.
A swift change in attitude as the White House scrambles to prevent the coronavirus from spreading among employees. Everyone entering the West Wing, where the president works, must wear a face mask. That is, almost everyone. President Donald Trump has refrained from wearing a mask in public and private and says he still doesn't see the need.
Well, if they're a certain distance from me or if they're a certain distance from each other, they do. In the case of me, I'm not close to anybody. I'd like to be close to these two gentlemen. They're hard-working, great men, but they just said, frankly, let's keep it this way. So obviously, in my case, I'm very far away from everyone.
The new face mask directive comes after 2 staffers tested positive for COVID-19. Katie Miller, the spokeswoman for Vice President Mike Pence, and one of President Trump's own valets. Pence is now in self-isolation, along with 3 other high-profile members of the government's coronavirus task force. They include leading epidemiologist Dr. Anthony Fauci, the face of the administration's response. Officials at the White House say that staffers are being tested regularly, but employees and reporters working in the West Wing have been voicing concerns over their safety.
The West Wing is a very old, cramped workspace, lots of small offices next to one another. Some of them don't even have windows. The ones that do have windows, I'm not even certain they can open the windows for fresh air because of security concerns. And everyone is passing each other in these narrow hallways, going back and forth to multiple meetings every day.
As officials try to contain the virus within the White House, President Trump is continuing to urge U.S. states to reopen their economies, despite many wondering if it's all still too soon.
Earlier, we spoke with DW correspondent Stefan Siemens about whether the U.S. economy can reopen with all this uncertainty about the spread of the virus.
That's the key question across the country. How do you restart the economy if you, A, don't know really how widespread the virus is, B, as soon as you open the country up a little bit, local communities open up for business again and states open up for business again, and the numbers are then in a trajectory up north again. So there's a trust issue, of course. People need to believe that they are safe before they go to work. Otherwise, nobody's going to work, and you do not open the economy then. So that's the big problem here for the president and everybody involved with solving this problem.
Stefan Siemens there. Well, among those at the forefront of the struggle to contain the pandemic are nurses. And since today is International Nurses Day, we're focusing on the sacrifices that they've been making to save lives. Our next report starts with a look at the woman credited with creating the modern profession, Florence Nightingale. Today also marks her birth 200 years ago.
The original queen of hygiene, Florence Nightingale. She revolutionized battlefield medicine during the Crimean War, when more British soldiers were dying of infections than battle wounds.
The principles remain is just exactly the same today as they did 200 years ago, which is you need to wash your hands and you need to make sure that the environment you work in is incredibly clean and tidy, and importantly, the space between patients and the need for ventilation.
The coronavirus pandemic has overwhelmed hospitals around the world. That's led many nurses to protest, from Peru to Washington, D.C., outside the White House.
Nurses are raising our voices across the country, and we demand to be heard. President Trump, Congress, and all other government officials, we demand that you immediately get PPE to nurses, doctors, and healthcare workers on the front lines of this pandemic. If you don't protect us, we can't protect our patients.
In Senegal, this nurse says there's a strong sense of duty in the profession.
We have no choice. From the moment you set out to become a nurse, to practice this profession, I think it's a source of pride to be a nurse, to be able to help people, to be able to help them recover their health.
One person who does appreciate nurses, street artist Banksy, whose latest work, Game Changer, is on display at a London hospital.
And we're joined now by the European Federation of Nurses Association's Secretary General, Paul de Rauw from Brussels. Thanks so much for being with us, Paul. And let me thank you and everyone in your profession for all you've been doing during this crisis. An estimated 179 healthcare staff in Britain alone have died during this pandemic, many of them nurses. What's the biggest risk that they're facing in this pandemic?
I think the pandemic came to us quite suddenly. So many member states in the European Union, including the Commission itself, was not prepared for this. And as such, the protection equipment that we need to have in order to go next to the patient, to wash the patient, to feed the patient, to nurse the patient, was not available. So even from the Ebola crisis in 2014, EFN wrote a report at that time. The title was, "We are not prepared unless we are all prepared." And in that report, EFN made clear recommendations. Please, governments, give your nurses, your physicians who are frontline, who are taking care of the patients, the PPEs, the masks, the materials that they need to protect themselves. And Paul, I think everybody's trying to do their best.
Okay, now, Paul, that report was 6 years ago calling for protection equipment. What went wrong? Why did national governments, why did the European Commission, Brussels, not listen to your call for help?
I think in that time, the Luxembourg Summit on Health was that preparedness. And Ebola crisis, you know, we had a few nurses who came to London, to Madrid, who were affected, who came from Africa. But, you know, this pandemic is totally different, has a totally different scale, and took governments by surprise. Also, the lack of coordination. You know, the Commission has there is still this subsidiarity principle. And, you know, in relation to health, governments has always said, yes, but this is not your responsibility until you have a serious problem. And then you miss out on the time. So we have always said, please make sure that the 16 recommendations that are in that report, they are suitable today. And we are not asking much. We just ask the things that we need to do our job properly and to not put ourselves at risk.
You think it'd be very simple to get masks and gloves to the people who need it most. Paul, thank you so very much. We have to leave it there. Thank you for all your work, and we'd like to recognize you on this International Nurses Day and all the people in your profession. Paul, thank you, sir. Thank you.
Be welcome.
Well, our next report now. Indonesia has suffered Asia's second highest death toll from COVID-19 behind China. And in the past 6 weeks, the partial lockdowns to prevent the spread of the coronavirus have cost more than 2 million Indonesians their jobs. Now, to help its citizens overcome these hard times, the government's turning to a novel form of social welfare.
This isn't your typical ATM machine. Instead of cash, it pumps out another valuable commodity. Rice. For free. The 1.5 kilo rice rations help these residents near Jakarta who are struggling to make ends meet because of the coronavirus. I was laid off by my company last week, and my husband was laid off too without severance pay. Although it isn't a lot, it's still very helpful. Those eligible are given special rice ATM cards, which they can take to the dispenser to collect their daily ration of rice.
Every day we prepare 1.5 tons of rice for around 1,000 residents. Multiply that by 2 months. We'll continue doing it every day without rest. Even on weekends, we will keep distributing.
According to the government, the pandemic has set back its efforts to eradicate poverty by an entire decade. Restrictions are being eased to allow markets like this one in central Java to reopen, even though it's still not clear if Indonesia's COVID-19 curve has been sufficiently flattened. What is certain is that initiatives like this rice ATM are needed to keep those who are struggling from going hungry.
Well, like other European nations, Spain has started easing some of its restrictions. Restaurants, hotels, museums, and some cities are now allowed to cautiously reopen. But many regions are still locked down. The government says almost half the country is yet to meet the criteria for lockdowns to be lifted. And even in cities that have been given the green light, well, business owners are very cautious. We have this from Sevilla.
This is the first time in 2 months that Joaquin Antonio has opened his doors. He stands at his coffee machine at 7 in the morning, just like he has in the last 28 years, ever since his father opened the cafe in the center of Seville. But things are very different now. New regulations state he can only serve customers outside with half as many tables as usual. Nonetheless, Antonio hopes a few patrons will come, or his cafe might not survive.
The last few months have been really tough. We had operating costs, but absolutely no income. State assistance helped, but it's still just a loan. We have to pay it all back and somehow keep our business afloat. We have to try at least. To be honest, it's all very depressing.
Seville fulfills all the criteria to qualify for an easing of social restrictions, a low rate of infections and a good supply of hospital beds. That puts it at a better footing than the capital, Madrid. But many Seville businesses will still stay closed. This time of year is peak season for Antonio Romero's specialty, cooked snails. But currently at his restaurant, he hasn't even set out the tables. He's running a small delivery service, but had to lay off his whole staff. He's frustrated by a lack of clear information from the government.
We were just told, okay, from today on you can open again. But up until the day before, they told us they didn't publicly announce anything about what that meant and exactly what regulations would have to be met.
Besides restaurants, small businesses and hotels are being allowed to open this week, at least on paper. Many shopkeepers also keep their businesses closed due to the strict regulations. Some have already given up. Empty shop windows and for rent signs are becoming more and more common in Spanish city centers. Spain is one of the countries most affected by the crisis at all levels. While pictures of overcrowded hospitals are only a few weeks old, the latest economic figures are causing new horror. Experts are warning of unemployment rates of more than 30%. Back at Joaquin Antonio's cafe, the terrace is slowly beginning to fill up. He's been able to re-employ 3 of his former staff. He's hoping the next easing of restrictions might mean he can soon invite customers inside too.
We're joined now by the correspondent who filed that report for us, Jan-Philipp Schultz. Good morning to you in Sevilla, Jan-Philipp. First off, more than half of Spain returned to a semblance of normality today, or yesterday rather, but half the country is still on lockdown.
Yes, that's true. But still, for the people here in Spain, it's been a huge step. It might seem still strict compared to other countries, but we have to keep in mind that until some days ago, all of Spain was under the strictest lockdown in all of Europe. So the new rules that are out now, they include, besides the opening of restaurants that we saw in the report, they also include a relaxation of measures on a personal level. For example, people can meet in small groups again. And what is very interesting about the Spanish model is that each region has to apply for a relaxation of measures. And then the central government decides if a region can move on or if a region has to wait.
Okay, so handing a lot of the responsibility for reopening down to the lowest level, that's the most local level, that sounds like a good idea. Well, what do people think of the loosening of the measures in general?
I think in general, people welcome the easing of measures because it's been very tough for them for more than 2 months now. You can see a lot of families out on the streets now strolling around. You can see people having a drink on the streets. So people are generally welcoming the steps. But we also have to keep in mind that Spain is still very heavily affected. The memories of overcrowded hospitals are still very fresh in the memories of the people. So the people welcome the steps, but they are still cautious at the same time.
Okay, they're still cautious right now, but what are the next steps, especially regarding the big cities like Madrid, Barcelona, the other regions that are still under tight restrictions?
Exactly. Barcelona and Madrid, they are still under tighter restrictions because their infection rates are still very high. So they cannot move on to the further levels of relaxation. When the head of the local government in Madrid tried to relax the restrictions, she received huge protests. A lot of her colleagues from other regions protested and said that the capital should not get a special treatment just because it's the capital of the country. So there are still a lot of discussions ahead. But what is for sure is that many regions can move on to the next level in 2 weeks. And this will also include the opening of cinemas and theaters.
Okay, Jan Philipp, thanks so much for that update from Sevilla and for your report as well today.
Thanks.
We're taking a look now at some of the other developments in the coronavirus pandemic. A new outbreak of coronavirus cases in South Korea has been linked to a man who visited a number of nightclubs while infected. The number of related new cases has now surpassed 100. Germany is also seeing a rise in new infections after some relaxation of lockdown restrictions. The government will contribute 750 million euros to develop a new vaccine. And after the first day of eased restrictions in France, that country also reporting an increase, this one in deaths from the virus on Monday.